Hi, my name is Sandra and I'm part of the Health Committee. Let's talk about leprosy. What is leprosy? Leprosy is a chronic progressive bacterial infection caused by the Mycobacterium leprae. Leprosy is also known as Hansen's disease. It was renamed after the Norwegian scientist Gerhard Henrik Amor Hansen. In 1873, this scientist discovered that slow-growing bacterium known as the Mycobacterium leprae is the cause of leprosy. We have two major types of leprosy: tuberculoid leprosy and lepromatous leprosy. Tuberculoid leprosy has limited disease in the body and relatively fewer bacteria in the skin and nerves, while lepromatous leprosy, however, has widespread disease in the body and also has quite a large number of bacteria in the skin and nerves. Thank you.
Hello, good afternoon. I'm the virtual lecturer, a third year midwifery student. Since today is World Leprosy Day, I'd like to talk about the major or main symptoms of leprosy. The main symptoms of leprosy include muscle weakness, numbness of the hands, arms, legs, and feet. There may be skin lesions as well. These skin lesions do not resolve even after several weeks. It may result in decreased sense of touch, increasing temperature, and pain. Thank you.
So, how does leprosy spread? Leprosy spreads through contact with mucosal secretions, that's through coughs and sneezes of an infected person. However, the disease is not as highly contagious as you might have thought, since the disease can only be contracted through close, repeated contact with an infected person for a very long period of time. Also, according to the World Health Organization, the disease has an average incubation period of 5 years, of which symptoms may not even appear for as long as 20 years.
Now let's move on to some myths about leprosy. Myth number 1, leprosy is incurable. That's very false. Leprosy can be cured using antibiotics and other treatments. Myth number 2, leprosy is as a result of a curse or sin. That's very false. From our video, we've been taught that leprosy is as a result of the Mycobacterium leprae, which attacks the mucus. Myth number 3, people still think leprosy can be contracted when someone gets into contact with a person infected with that leprosy. That's very false. The contact should be very long and it should be as a result of mucosal secretions, like a person coughing onto you. How do we diagnose Hansen's disease? Now, Hansen's disease can be diagnosed as small patches on the skin. This may be lighter or darker than normal. And for you to know this, that it's actually caused by the Mycobacterium leprae, you have to take a biopsy from the skin or the nerve and view under a microscope. You might also want to do other investigations to rule out any other diagnosis. Now, another common feature is that there will be loss of sensation to that particular patch on the skin. But please don't go around testing people because you think their patches might be from Mycobacterium leprae. Thank you.
So, one might want to know, what is the treatment for Hansen's disease? Hansen's disease is treated with a combination of antibiotics. Typically, 2 or 3 drugs are used at the same time. These drugs are dapsone with rifampicin, and clofazimine is also added for some types of the disease. It is known as the multi-drug therapy. This strategy helps prevent the development of antibiotic resistance by the bacteria, which may otherwise occur due to the length of the treatment. Treatments for Hansen's disease usually last between 1 to 2 years.
Okay, viewers, this brings us to the end of the video. And today, being the World Leprosy Day celebration, we've come your way with this educative piece. We are students from the nursing department of KNUST. Thanks for watching.